When the Guam Regional Medical City officially opened for business last week, it became the first privately owned hospital to open here in almost 4 decades. Why has it taken so long? Among the most cited reasons is that Guam does not have the patient base to support all the specialized care that hospitals typically provide. But GRMC's strategy can be found in its name, the Guam Regional Medical City, with regional being the operative word. The new hospital hopes to attract patients not just from Guam, but from throughout Micronesia to provide the scale it believes it needs to succeed. GRMC commissioned a study funded by the Asian Development Bank on the feasibility of a regional medical facility based on Guam. CEO Margaret Bengzon presented the results and her plan to leaders at the July meeting of the Association of Pacific Island Legislatures.
So the idea is to set up a accountable care organization, which is an organization that hooks together and links together in integrated fashion various care settings. So you have ambulatory settings, and you have hospital settings, and you have rehabilitation settings, and they're all put together in a coordinated, integrated fashion. So this is a model of care that ensures quality and safety and cost effectiveness. And this is what we're proposing with Guam Regional Medical City as the hub, and with some local presence for GRMC and TMC in the different regions.
But even with a larger regional patient base, it will still come down to the collective ability to pay. Non-payment of hospital service has been a perennial problem for government-run Guam Memorial, which has relied on government subsidies to keep afloat. A privately owned facility like GRMC does not have that luxury. So the new hospital is also at the center of an effort to address health care affordability. Speaker Judy Wanpat, for one, has been pushing the idea of a regional health insurance plan.
I went to visit Palau to see what they did with their plan that they currently have, that it seems to be working. It's just that the biggest problem, of course, is that when you have a small number, then naturally you still pay more. So what I was thinking of was that we needed a universal regional health insurance that will be accessible to all of our neighboring islands, that it be affordable. And because if it's affordable, just think of the economy of scale, is that we include everyone in it, then that means we'll be able to make it affordable for everyone. And then the last is that it be portable, that they'll be able to take it then from place to place, and they would be covered.
This is actually something that's been in discussion for a very long time now, and we're helping move it forward. We obviously need support from the federal government. Medical City has invested some monies to make sure that this process works, and we're moving forward.
Wanpat first floated her idea more than 2 years ago. She asked the Interior Department for funding to pay for a cost and risk analysis, but she was turned down. Since then, she's been lobbying with Micronesian leaders to pay for it out of their compact money.
So I've written letters again to all the ministers of health, the foreign ministers, the presidents and the governors, asking them now, taking very different approaches, asking them is either, can you then put in a request to use, take out $100,000 per state in FSM and $100,000 from RMI. So that will come out $500,000. So we'll be able to hire a consultant to do an actuarial study and look at the feasibility of actually having a universal health insurance for everyone.
In addition to the Speaker's Regional Health Insurance Initiative, there may be another source of potential help: the Affordable Care Act, more commonly known as Obamacare. Local health insurance executive Frank Campillo says a recent Supreme Court ruling that upheld federal subsidies for the states should also apply to Guam.
The Supreme Court of the United States, actually, the way they phrase the decision is that the market could collapse if the subsidies actually, and that was the argument of the Solicitor General, the market will collapse, the law will collapse if we don't provide these subsidies.
Currently, Guam is excluded from the Affordable Care Act, so it has not established a local health insurance exchange or a health care marketplace through which the subsidies would be provided. Campillo says GovGuam officials and local health insurers are working to come up with a strategy to get Guam included in the ACA. He says the impact of the health insurance premium subsidies for Guam subscribers could be substantial based on current federal guidelines.
If you are 400% above the federal poverty line, you will be able to get subsidies. So a family of four making $80,000, they still will be able to get federal subsidies because of the 400% limit in the federal poverty line. So, in my opinion, about 80% of the island will be able to qualify for those premium subsidies if the island was eligible for subsidies like that.
But given those ratios and the U.S. government's current fiscal condition, Campillo concedes getting federal support could prove very difficult. But if ever there was a good time to try and get Guam included in Obamacare, he thinks it could be now.
If we try, and I think if we appeal to the president has about a year and a half left into his presidency. And apparently, he's an individual that wants to bring equality to the United States of America. So I think we can appeal to that and say, Mr. President, bring equality to the islands of Guam, of the islands of Micronesia. And that equality will be extend premium subsidies on the Affordable Care Act, something that you believe very, very strongly on. Extend that to the islands of Micronesia.
For KOM's Business Matters, I'm Nestor Lecanto.